Beverley Callard, 69, says she's felt dreadful as she shares candid health update after completing radiotherapy treatment amid breast cancer battle. Beverley Callard has shared a candid health update after completing radiotherapy treatment amid her breast cancer diagnosis. The Coronation Street star, 69, was diagnosed with breast cancer earlier this year and has constantly updated followers during her treatment and hospital appointments. Last week, the actress shared the fantastic news that she had completed all 10 of her radiotherapy sessions. And on Monday, Beverley took to Instagram and gave her followers an update on how she's doing, admitting she's felt dreadful. Sharing a clip of her sitting on the bed, she said, "Well, what a weekend."
Tired of messy watermelon prep? The crisp taste 2-in-1 watermelon cutter slices neat cubes quickly, then switches to a retractable fork for easy serving with less mess. Want to check today's Amazon deal? Scan the QR code now or visit grabdeal.us/3 before it's gone.
I finished radiotherapy for now last Thursday, and in my naivety I thought, well, that's great. More often than not, I've done really well. Sometimes feeling a bit poorly and etc., but not too bad at all. This weekend, oh my God, I felt dreadful. My skin on my chest and everywhere is now so sore. I'm putting all sorts of things on. Aloe vera, loads of lotions and potions, and I've been so nauseous and almost like morning sickness. I've only been sick a couple of times, but I feel dizzy, I feel worn out. It's funny because a nurse did say to me, "It's not actually over," she said. "Really, it's the beginning when you sort of finish your treatment." So I understand what she meant now, and another lady said to me, "Beverley, you're still cooking," and I understand that now as well. My skin is so hot, and it feels hot inside as well. So I'm coping, and I'm trying hard, but I do have to rest a lot, so I'm going to research vitamins and health foods. I am eating healthily, although my appetite is gone. But yeah, I'm going to do lots of research. So anybody else going through it, just remember, don't expect too much of yourself. Alongside the post, Beverley penned, "Apparently I'm still cooking and trust me, it feels like it." Last week, Beverley shared the incredible news that she has finished her radiotherapy treatment. Addressing her fans, she said, "I've done it. I've just finished my last radiotherapy session. Yep, that was number 10 for me and lots of people have to have lots more, I know that, but for now that's finished. So hopefully, I don't know for sure, but hopefully I won't need any more." Her husband John McEwen interjected, "Positive thinking, darling," as she replied, "That's it. Yes, definitely." She continued, "To be honest, I feel a bit numb because yesterday I really struggled, but today I've been fine and now I've got to see the professor again in 2 months, and then I'll know a lot more, and mammograms and oncologists and all that. But radiotherapy is finished for now, so I'm really thrilled. I'm going to put scruffy clothes on and just sit and watch TV with a cup of tea." Last month, Beverley gave an update on her radiotherapy treatment plan as she revealed she would be having 10 days of radiotherapy, 5 consecutive days, then a weekend off, then 5 more days. She said, "I'm not sure when it starts yet. They will send me an appointment to have a body scan and do the mapping. That's the first thing, and they'll let me know soon when that begins, so really that's all I know at the moment." She confirmed that she is still able to work while she awaits treatment starting. Beverley also said how medics were worried she should have started radiotherapy earlier following her breast cancer diagnosis. The star admitted it wasn't what she wanted to hear after attending the hospital to discuss a treatment plan with doctors. Beverley has moved to Ireland from England and revealed it had taken a while for her medical records to be transferred between the countries. She also marked a huge milestone last month after she returned to work, admitting she felt nervous and on edge as she arrived ready to film scenes for Fair City after 4 months away while she had surgery. Beverley joined the cast of Ireland's Arte soap opera Fair City in February as Lily, the quirky and unpredictable long-lost mother of Carrickstown resident Gwen. That same month, while she was just about to go on set, the soap star got a call from her doctor that she had breast cancer and so returned to the UK to have surgery and treatment. In an Instagram video, Beverley revealed her husband John had driven her to work. She said, "I have to tell you, it's like the first day back at term at school. I'm really nervous and on edge, but nicely so. So wish me luck, I'll let you know how it goes." After a day of filming, Beverley updated her followers and seemed delighted with how it all went. She said, "Home for my first day at work, and do you know what? As I said before, it was a bit nerve-wracking. You think first day of term, this is scary. But as soon as I was in there, you just feel like you've never been away. Everybody was so pleased to see me, and I was really pleased to see them. We laughed a lot and got the giggles. It was just fantastic. I have a very early start tomorrow, which I'm not looking forward to, but there we go." Breast cancer is one of the most common cancers in the world. Each year in the UK, there are more than 55,000 new cases, and the disease claims the lives of 11,500 women. In the US, it strikes 266,000 each year and kills 40,000. But what causes it, and how can it be treated? It comes from a cancerous cell which develops in the lining of a duct or lobule in one of the breasts. When the breast cancer has spread into surrounding tissue, it is called invasive. Some people are diagnosed with carcinoma in situ, where no cancer cells have grown beyond the duct or lobule. Most cases develop in those over the age of 50, but younger women are sometimes affected. Breast cancer can develop in men, though this is rare. Staging indicates how big the cancer is and whether it has spread. Stage 1 is the earliest stage, and Stage 4 means the cancer has spread to another part of the body. The cancerous cells are graded from low, which means a slow growth, to high, which is fast growing. High-grade cancers are more likely to come back after they have first been treated. A cancerous tumor starts from one abnormal cell. The exact reason why a cell becomes cancerous is unclear. It is thought that something damages or alters certain genes in the cell. This makes the cell abnormal and multiply, out of control. Although breast cancer can develop for no apparent reason, there are some risk factors that can increase the chance, such as genetics. The usual first symptom is a painless lump in the breast, although most are not cancerous and are fluid-filled cysts, which are benign. The first place that breast cancer usually spreads to is the lymph nodes in the armpit. If this occurs, you will develop a swelling or lump in an armpit. If you are confirmed to have breast cancer, further tests may be needed to assess if it has spread. For example, blood tests, an ultrasound scan of the liver, or a chest X-ray. Treatment options which may be considered include surgery, chemotherapy, radiotherapy, and hormone treatment. Often a combination of 2 or more of these treatments are used. The outlook is best in those who are diagnosed when the cancer is still small and has not spread. Surgical removal of a tumor in an early stage may then give a good chance of cure. The routine mammography offered to women between the ages of 50 and 71 means more breast cancers are being diagnosed and treated at an early stage. For more information, visit breastcancerno.org or call its free helpline on 0800 800 6000.